Good morning to everyone, to Lázaro, to the sign language interpreter, to our colleagues on the radio, and the audience tuned in to this briefing. We start today's press conference with the unfortunate news of the death of two patients. One is a 90-year-old female patient from Ciego de Ávila province and the municipality of the same name, who suffered from some comorbidities. She was hospitalized due to a vascular event and showed some respiratory problems. She was tested for COVID-19 and was diagnosed with the disease. Her evolution was rather unfavorable and unfortunately died yesterday. We offer our condolences to her family and friends, and we sincerely regret the disease. The other patient is a 58-year-old man, also from Ciego de Ávila. He suffered from hypertension, showed the first symptoms and was admitted on September the 3rd. He tested positive for COVID-19. While being hospitalized, he suffered from shortness of breath and fever. The patient did not evolve favorably and unfortunately died yesterday despite the efforts of our specialists and treatment protocols. I reiterate our condolences to his relatives and friends. As I have stressed in previous briefings, it's difficult for us who work directly in this field to provide such regrettable news. As of today, we report 1,614 hospitalized patients, 61 under medical supervision, 889 are suspected cases, and 664 are confirmed active cases, quite a high number that responds to the amount of diagnosed cases these last days. Yesterday, over 7,000 samples were processed, 7,569 to be exact, in the molecular biology laboratories of our country that are committed to this task. 2,867 at the Tropical Medicine Institute Pedro Coury, 916 in Havana's Hygiene, Epidemiology and Microbiology Center, 208 in Santiago de Cubas, and 555 in Villa Claras, 564 in the Genetic Engineering and Biotechnology Lab, 580 in Hermanos Amejeiras Hospital, 420 in Manuel Fajardo's Hospital, 339 in the National Civil Defense Lab, 318 in the Center for Molecular Immunology, 318 in Fructuoso Rodriguez Hospital, 260 in the Genetic National Center, 259 in the Naval Hospital. As you can notice, these are high figures and the outcome of the hard work of our specialists. I'm positive that in the next few days we'll reach the 8,000 collected samples aimed at searching for possible asymptomatic patients that may be transmitting the virus within the community in order to isolate them and properly treat them. As a result of the analysis and processing of these samples, 92 people tested positive for COVID-19, being this figure the highest thus far, for a total of 462,293 analyzed samples in Cuba, of which 4,551 people have been diagnosed with the disease. Samples from all of the country's provinces were tested depending on its epidemiological complexity. Pinar del Rio analyzed 362 samples, Artemisa 387, Havana the most with 5,790, Matanzas 151, Ciego de Ávila 277, Cienfuegos maintains quite a good surveillance with 162 analyzed samples and so forth from every Cuban province. Of the 92 positive cases, 91 are Cubans and one is a foreign resident in our country, not imported but a local transmission case. 82 or the 89.1% are confirmed case contacts. This means that the 89.4% of all cases diagnosed in Cuba have had contact with someone who had previously tested positive to the virus. The source of infection linked to 9 patients is yet to be determined, for a cumulative of 55 or 1.2% over the last 15 days whose source of infection is being investigated. Of the 92 cases, 1 contracted the disease abroad. That patient arrived to Cuba and was diagnosed while being in isolation. Hence, it accounts for 428 imported cases. 54 patients, that is the 88.7% of all cases confirmed yesterday, were asymptomatic at the moment of the test. And I stress, they transmit the disease, which accounts for the 58.9% of all confirmed cases in Cuba up to date. If we look at the last 15 days, the figure stands for 463, or the 64.8% that have not presented any symptoms at the moment of the test. 41 patients are male and 51 are female, which maintains a balance of 50% in each group. There are not significant differences in this regard. By age groups, 14 individuals are under the age of 20. As for tomorrow, we'll be providing the information concerning the amount of patients in pediatric ages. 28 patients are between 20 and 39 years of age, 35 patients between 40 and 59 years of age, and 15 patients exceed 60 years of age. Of the 92 diagnosed cases, 50 belong to Havana, 27 to Ciego de Ávila, 10 to Artemisa, 2 each from Santi Espíritu and Mayabeque, 1 from Santiago de Cuba, which is the aforementioned imported case, and does not affect the province incidence rate inasmuch the patient has been isolated and treated in Havana's hospitals. Of the 27 cases from Ciego de Ávila, 18 belong to the municipality of the same name, 6 to Majagua, 2 to Venezuela, and 1 to Ciro Redondo. In Santi Espíritu, the 2 diagnosed cases belong to Trinidad municipality, and, as I mentioned, the patient from Santiago de Cuba is the imported case. In Artemisa, 6 are from Candelaria, 3 from San Cristobal, and 1 from Alquizar. In Mayabeque, 1 each from San Jose and Nueva Paz. The 50 cases from Havana belong 8 to Boyeros, 7 to Guanabacoa, 4 each to La Lisa and Arroyo Naranjo, 3 each from the municipalities of Marianao, Cerro, Habana del Este, Playa, and Regla, 2 cases each from Plaza, San Miguel, Habana Vieja, Centro Habana, and Cotorro. There's a great spread of the disease in Havana province, as you can notice. I'll ask Leonardo's support to bring up a map that presents Havana and Ciego de Ávila's epidemiological situation. As I mentioned, there's a significant spread of the virus in Havana province. The yellow part in the middle of the picture highlights the area of Párraga. At the bottom, we can see Boyeros with 1 cluster. In the upper right is Regla with some other events of local transmission. The main objective is to show the spread of the disease in Havana province. In Ciego de Ávila, it's displayed the event in the municipality of the same name, another in Luaces Hospital, in Majagua, and Morón. The darkest color highlights the area where there are over 20 cases. The other colors represent areas with 10 to 20 cases and 9 or less. Therefore, Ciego de Ávila's confirmed rate per 100,000 inhabitants is the highest in the country, with 27.68, Havana's 22.25, Artemisa's 14.76, all of them higher than the previous day. Matanzas with 5.14, Pinar del Río with 1.37, Las Tunas 0.93, Camagüey 0.13, same as yesterday's rate. Santi Espíritus 1.29, Mayabeque 1.04, both higher than the day before. Villa Clara 0.26, lower than yesterday's rate. With this analysis, of the 4,551 diagnosed patients in Cuba, 664 are confirmed and hospitalized active cases, that is 14.6%, of which 652, or the 98.2%, present a clinically stable evolution. At the beginning of the briefing, we reported 2 deaths, what brings the COVID-19 death toll in Cuba to 106. This means that the island has a mortality rate of 2.32%, lower than the global rate of 3.25% and the regional rate of 3.47%. But still, we are not pleased with these results, since we were to prevent any fatalities. We always mention the 2 evacuated patients at the start of the pandemic. Yesterday, 52 patients were discharged from hospital, not a positive indicator regarding the discharged and confirmed case ratio. 44 are from Havana, 4 from Ciego de Ávila, 2 from Pinar del Río, and 1 each from Matanzas and Villa Clara. Thus, we accumulate 3,779 people, or the 83.1% of all diagnosed cases in Cuba recovered from the disease. 2 patients are in a critical state, 1 hospitalized in Ciego de Ávila and the other in Camagüey. 10 patients are reported as serious, of which 3 are admitted to Camagüey's military hospital and the rest are being treated in Havana's hospitals. This is the behavior of the pandemic in Cuba as of yesterday. Concerning worldwide statistics, the world still faces a complex situation. COVID-19 pandemic remains to be present in 185 countries. 242,760 people were diagnosed with the disease only yesterday, for a total amount of 27,609,408 infections. 5,003 deaths were reported only yesterday, which accounts for 898,087 fatalities and a mortality rate of 3.25%. The region of the Americas reports 14,362,738 infections, which represents the 52.02% of worldwide cases, and 77,897 people were diagnosed only yesterday. 2,553 deaths occurred in our region, what brings the death toll to 498,782 and a mortality rate of 3.47%. In the list of the top 10 most affected countries in the world, the United States occupies the first position with 6,327,793 diagnosed cases and 189,679 fatalities. India follows with more than 4,470,000, Brazil with more than 4,162,000, and Russia with 1,035,000. Now turning our attention to the Americas region, after the United States of America and Brazil comes Peru, Colombia, Mexico, Argentina, and Chile. Highlighted in red, we can see the mortality rates of Mexico with 10.65% and Ecuador with 9.59%. At the bottom of the picture, we see Cuba's position with a mortality rate of 2.32%. Finally, I will bring to you a chart created by Dr. Millán that reflects the amount of cases in Cuba since the start of the pandemic. We're able to see the upward curve during the months of April, May, and also at the end of March, followed by a significant decrease of cases up to August, where a great increase of cases again can be evidenced in this chart. Then there's another picture that shows the behavior of critical and serious condition patients from June the 1st up to September the 1st. The bars denote a rise of serious and critical cases as from August the 2nd up to September the 9th, represented by dark brown and red colors respectively. This is all the information on the behavior of the pandemic in Cuba and the world.